Last week across the country, the new healthcare law launched the biggest and centerpiece, largest part, most important part of the whole plan, the healthcare exchanges. Two different options: the federal exchange, those are for states that do not have their own healthcare exchange, and the state-run exchanges. If you're in North Dakota, you're on the federal exchange. I can't tell you a whole lot about that. It's kind of confusing. But if you're in the state of Minnesota, I can help you out a little bit with MNsure. Now, no doubt that when both these programs launched last Tuesday, it wasn't that great. They had a lot of hiccups, a lot of problems. The state MNsure online healthcare exchange was operational by about 3 o'clock in the afternoon. The federal one, well, it was going up and down, on and off throughout the day and continues to have problems. However, by now, most of them should be worked out. MNsure pretty much had itself launching and up and operational. However, did say it might take another week before all the different features available on the website are there. But the point is, they have started. And what do these health insurance exchanges mean? Well, at least when it comes to MNsure in the state of Minnesota, they operate very, very similar to something like Hotels.com or Expedia. Literally, the healthcare exchange will give you a bunch of options of where to buy your health insurance from. You're buying it from Health Partners, Preferred One, Blue Cross Blue Shield, Medica, and a few other options too, depending on where you live in the state. But those are the big ones here, Becker County and in the Lakes area. But cost is the big factor. I can only speak for myself personally when I looked at the cost comparison for myself versus what I get through my employer. And there's a lot of different options. However, they do appear to be pretty competitive. However, that statement might not be true for everyone. There are some safety issues, though, however, with MNsure in the state of Minnesota when it comes to your data, privacy, and policies along those lines. There's questions over the training of some of the people that are going to have the sensitive data in your hands. There was a breach of 1,600 different people's social security numbers and other kinds of information. These things hopefully will get worked out, but they are part of the problems that we are having with these healthcare exchange. However, anything this big, we have to expect some kind of problems. But I am questioning a little bit about the whole Healthcare and Affordability Act and how it's supposed to be more affordable. You know, I look around here in the Lakes area. Here in Detroit Lakes, the hospital has gone through a huge expansion. It's had 3 different owners in the last 7 years since I've been here. Perm's built a new hospital out there. Cities like Frazee are looking at getting clinics. Other communities are building new hospitals and refurbishing them. Obviously, there's still a lot of money tied up somewhere in the medical world if we're having all this building and expansion going on. Part of it could be in anticipation of the baby boomer generation retiring too. I guess I'm not quite sure of all the factors. But the guy can look around and just use common sense and say, boy, these hospitals are expanding awfully quickly. Also, when it comes to our insurance premiums, is that part of the reason we might see increases? Personally, I saw a 10% increase in my insurance premium. They've been told, or I've been told at least, that's directly due to taxes incremented by Obamacare, but we should only see that big of an increase at once. The real question people want to know, is this good or is this bad? I can't tell you yet. We don't know. Unfortunately, we're going down a path that we've never gone down before in this country with this Affordable Care Act, also known as Obamacare. That's another thing that's sad. Some people don't even realize there's a difference between the two. I had one person tell me they support the Affordable Care Act but didn't like Obamacare because Obamacare carries some negative connotation with it, realizing, of course, that we're talking about the exact same piece of legislation. And that's the issue. Americans are confused. We don't know what's happening with this. We're all jumping in this together. As far as it being good or bad, only time will tell. I'm preparing for the worst, but I'm hoping for the best.